Let's talk about circumcision. Circumcision is one of the issues, Lewis, that on this program fires people up to no end. The other one being the Israeli-Palestinian conflict. Interestingly enough, both are at least tangentially related to Jews. And U.S. health officials yesterday released a draft of long-awaited federal guidelines on circumcision. And the Center for Disease Control and Prevention has come out and said the benefits of male circumcision outweigh the risks. And they went on to say that this is a personal decision that may involve religious or cultural preferences, but that, quote, the scientific evidence is clear that the benefits outweigh the risks. There are huge controversies mounting over this. There are groups that call themselves intactivists and anti-circumcision advocates that are absolutely furious, Lewis. Any surprise that this is the recommendation?
No. We heard something similar last year, or maybe it was early this year, and this seemed to be the general consensus among, I think it was from the pediatrics.
It was the American Pediatric Association, that's right. And the basis for these guidelines from the CDC, why they've determined that the benefits outweigh the risks, but leave the decision to individual parents, are that circumcision cuts a man's risk of getting HIV from an infected female partner by 50 to 60%, reduces the risk of genital herpes and certain strains of HPV by 30% or more, and lowers the risk of urinary tract infections during infancy and cancer of the penis in adulthood. So let's go through some of the reactions I've already received on Twitter. Number one, David, this is exactly the same as female genital mutilation, where entire parts of the woman's vagina are sometimes removed. Of course, the one main difference is that all of these versions of female genital mutilation serve no medical purpose, and they have a more significant risk of inflicting serious harm, both physically and psychologically. And while we will hear from the anti-circumcision group, Lewis, that we don't know for sure that there isn't huge psychological trauma inflicted by infant circumcision, and we have anecdotal stories of circumcisions going bad, that is not the same as a procedure that serves no medical purpose, that has been verified by the medical community. Regardless of what those doing FGM might say, we don't have an independent medical community saying, yes, this serves a medical purpose. Now, you will hear as an extension of this argument, well, but David, if you remove the penis entirely, you would also experience no penis-related conditions because the person would have no penis at all. That is an absolutely absurd equation to draw. And if that's where you're operating, you're not really going to be able to have a rational discussion, I don't think, Lewis.
No, I mean, why don't you just cut someone's head off and then they'll never have any brain tumors or Alzheimer's or anything of that nature?
No, I know, Lewis, that it's ridiculous, but this is the argument that some of the anti-circumcision advocates make.
Well, they're going to need to find better arguments if they want to be in the conversation. And as far as FGM goes, I think it's important to talk about motivations. When it comes to FGM, certainly the motivations are not medical. They are not to help the women. Well, you know what happens with women in those countries.
Thing. They argue that it is. They say it's to, prevent the woman from having sexual pleasure, and that circumcision is in some religious circles to prevent boys from starting to masturbate on their own. But these are distractions because we can focus just on the medical, and we don't even need to go in that direction. And this is what gets us into the argument number two, which is, David, the children don't get the chance to decide. The parents are making a decision for them, and it's a decision that is not reversible. Well, if you're making that argument about circumcision, why aren't you making that argument about all other medical decisions that are not reversible that parents make about kids? At the top of the list being vaccines. There's huge controversy over vaccination. You can't undo the fact that you vaccinated your child. As they age, they could decide they want no more vaccines, but we don't see that parallel drawn. And this idea that it's okay for parents to make other medical decisions, which have an impact that cannot be reversed, but this one decision on which there is medical data, it's not okay for parents to make for kids.
The parents are making every decision. But I think the people here will argue that this is an unnecessary decision, and that perhaps vaccines are necessary, perhaps the other decisions are necessary. But I guess that's still up for debate.
Right, and then you become embroiled in a more nuanced argument, which is no longer about parents making decisions that children have no say in, but you get back to the specifics of this decision, and we actually have the medical data. The last argument, of course, that as a sexual pleasure issue, that circumcised men have less sexual pleasure than uncircumcised men. This, to me, is more or less a distraction. There are very few people who can actually comment about the amount of sexual pleasure pre- and post-circumcision due to the rare nature of adult circumcision. Anecdotally, you see both cases made. I mean, Richard Branson, when he was on the Howard Stern show, he had an adult circumcision because of some kind of issue that he was having with his foreskin, and he said he had more pleasure after circumcision than before. So that argument really does not seem like a strong one in either direction for me.
Yeah, I mean, just thinking about the extra skin and how a penis works, having one myself, I would assume that it would actually be more pleasurable after a circumcision.
And wow, Lewis putting his foot down on this. I'm shocked.
That's just my guess. Of course, like you said, I can't. I'm not an expert on this. I don't know for sure.
Send me your thoughts. I know a lot of people will not like our commentary, but our commentary is merely based on the facts of the situation. People are, like the CDC says, open to having circumcision for their children or not. And that's a decision every parent can make for themselves.